right, hello and welcome to your Foundations Yoga class. So this is the very first practice that I'm posting for this course, and it is basically just the foundation of the practice. So in it we will cover all of the planes of movement and the connections. So the connections are something that are really important to know about in your body when you're moving. And I'm going to try my very best to make it really clear to you. So we will talk about connections throughout all the classes, but this is the intro. And we'll also go over pelvic floor breath, which is super important for many reasons. Basically, the pelvic floor helps to pump lymph through your body, supports your organs, prevents you from peeing or pooping your pants, obviously helps to release your baby out into the world. And it's a really important part of our body that often gets overlooked. So now is a great time to start to practice this pelvic floor breath. So it helps with pain, incontinence, imbalance in the pelvis as well as lots of other things. So there is a component that's called the pelvic floor crash course, where we're going to dive even deeper into the pelvic floor and into the functions of pelvic floor and the pelvic floor breath. So the intro to pelvic floor will be today as well. So we're going to go over quickly the planes of movement. So we've got 3 planes of movement that are included in all of the classes. And there's a reason for that. It's because we need to move in all different planes in order to support our structure. So when we walk, we don't just walk like a robot. We move into other planes. So first plane we're going to talk about is the sagittal plane. So that's any movement that's out in front of you, basically where you're just kind of lifting your arms, lifting your legs, reaching back. So forward folds, cat-cow, squats, warrior pose, all of these are sagittal plane movements. And a lot of yoga practice is done in the sagittal plane. So those are great, but we also need other planes to support that. So we're going to look into transverse, which are rotational in nature, so anything that has a twist. Okay, so anything where, like this, where we're rotating the leg bone, that's a transverse movement. And then we've also got the frontal plane. So we do have lots of poses that are frontal plane. So we've got triangle pose. Right, we've got warrior, we've got our reverse warrior, side angle. We've got lots of poses that are frontal plane, and these are all really important in moving. So a component of the frontal plane is a side bend. All right, and our spines really need to be able to move in all directions, front, back, rotation, side to side, to be able to support our bodies. So that's how we can stay healthy and strong and stable throughout our pregnancies and our life in general. Okay, so I will talk more about planes of movement, but we're going to get started. So you're going to need for this class 2 blocks. Any kind of blocks are good. A blanket or a pillow, and a bolster if you have one. If you don't have a bolster, you can always use another pillow. All right, so we're going to get started with the pelvic floor breath. So I like to sit and be supported on a bolster for this. And then just take a moment to find your comfortable seated position. So if you're in this position and your knees are not liking it, or your pelvic floor, or if you have some pain in your pubic symphysis being this cartilage in between the 2 sides of the pelvic bones. All right, so get comfy. So if you do have pain, you can always add some more height to your setup, which is excellent, or you can sit cross-legged. Okay, so nice and high, and this way when you're sitting, you've got your pelvic floor is supported by the bolster underneath you. Okay, you can even do this in a chair as long as you're sitting on your sitting bones. So our pelvis, it's really important that we sit on our sitting bones. Sitting bones, okay? If we're sitting back and our tailbone is curled under and we're sitting more towards the tailbone, our pelvic floor does not like that, and it can get really tight and uncomfortable. So sitting in chairs and sitting on the couch is really, really hard on your pelvic floor. So that's why when we sit, we want to make sure that we're on our sitting bones and that you can feel that your pelvic floor is supported. All right, so visualization is important, and I always like to introduce it right off the bat. So pelvic floor, a couple things you can visualize with the pelvic floor breath. One is like a balloon, so it's like you're blowing up a balloon and the pelvic floor is relaxing down towards the bolster on your inhale, and then as you exhale, it's deflating and lifting. Okay, so there's that visual of a balloon inflating and slightly deflating. So the inhale and then the exhale deflates. Okay, so that's one. Another really great visual that I enjoy is the jellyfish. So if you imagine a jellyfish, it kind of it expands, so it's like an inhale, and then the exhale would be the gathering itself up, so everything gathers into the middle of the jellyfish, and then it expands out again, and then you exhale and it gathers up and expands out. So it's like, that's how the jellyfish moves through the water. So that can be a really helpful visual as well. Another one is a Kleenex. So if you just imagine a Kleenex is really light and it just kind of spreads out, and then you could lift it up just by the middle, and then it's really gently lifting up. So the pelvic floor breath is about 5% of what a Kegel exercise would be. So if you think of a Kegel as like a contraction of the pelvic floor, most of us are really good at that contraction part. But this breath is focused really on the relaxation and the slight lifting up and in of the pelvic floor, and the coordination of the two. So there's really three parts to it. There's the relaxing, and then the inhale and lift, and the ability to coordinate that with your breath. So I know that it does take some practice to get used to, and which is totally normal. So just know that if you're not getting it right off the bat, practice is your very best way of doing this. And then you can always refer to the pelvic floor crash course, which will be coming soon. All right, so we'll take about 1 minute here to do the breath. So I just want you to get as comfortable as you can, whatever that looks like. You're seated. You could even be in resting child's pose with your head resting on a bolster or the floor. You could be cross-legged or just sitting on your bum on a block would be fine too. So just take a minute and just feel yourself in space. Feel where your body is. Feel your sitting bones. And feel the length of your spine. Notice how your shoulder blades feel. And where the back of your head or where your head is sitting compared to your pelvis. And just take a minute to really sink in to your sitting bones, and just start to sense your breath. So we're not changing the breath, we're just sensing the breath right now. And when you're ready, we're going to start the pelvic floor breath. So an inhale allows the pelvic floor to relax. And the exhale is like the gathering up, like a jellyfish. Inhale, expanding out. Exhale, gathering up. Inhale, expand. Exhale, gather up. So notice if, when you do this breath, if you start to get tense in the jaw or the shoulder blades, or if your bum wants to be really involved. And see if you can just let all of that soften and really just have the pelvic floor be part of this. Okay, so the jaw doesn't have to get involved, and often the two are very linked. If you're tight through your jaw, it's likely that you're really tight through the pelvic floor as well. Just something to be aware of. So a few more rounds like that. And again, know that if it doesn't feel right today, you have lots of time to practice, and you can always reach out for some more guidance on this. All right, so pelvic floor breath will be used in a few poses, not all of them. Some of them we're just moving and breathing. We're not focusing so much on this pelvic floor breath, but some we will link the two. Okay, so let's move these out of the way. And we're going to get started with the movement practice. So on hands and knees, I'm just going to put my pelvis back together. Okay, didn't stay. Hands and knees. Starting with rocking. So the legs and bum are really what's driving this. Shoulders and neck are relaxed. So if you find that this is uncomfortable and being in an all fours position makes you have lots of tension through your legs, first of all, know that it can change, and the more you practice, the work that we're going to be doing over these next 7 videos will help to unwind that. But to start, if it's too much, you can always have your hands on a stool. So this is my headstand bench. Looks like a weird toilet, but it's not. Okay, so you can have your hands resting on forearms resting on a stool, and you can do the same thing. Okay? So the reason that I always introduce rocking is because it's a fabulous way to start to get in touch with your core, or the center of your body. So often I see this. I see people really sinking in through the low back. The belly is really pulling them down. And so what I see there is I see a disconnect between the rib cage and the pelvis. So this is our first connection. Rib cage, pelvis. So I just want you to think about how you can lessen that curve a little bit. And then you can start to feel like you have some connection between this lower rib cage and the pelvis. Okay, so we'll just do a couple more rocks. And we want to do this so that when we start the rest of the exercise, we're in a good position. We're not in this compromised position that's disconnected. So our front body is connected. There's some strength here. Okay, to further explore this, we're going to add in some breath. So imagine that you have a birthday cake with a lot of candles on it, and you're going to blow out through your mouth. And as you do that, you're going to think about bringing the rib cage and the pelvis a little bit closer together, so your back will arch. And then as you inhale, you just release and relax. Exhale. Inhale, relax. So there is some component of the pelvic floor breath here. So we're inhaling, or you're exhaling to contract slightly, so you can use the pelvic floor in this, and then you're inhaling to relax. So we're starting to build that connection and feel how when we exhale, we can bring the ribs and pelvis closer together, and then we inhale and we can relax that. And I just want to make sure that when you're moving into any of these poses, these sagittal cat-cow, that you're not feeling it in the low back. So if you are, you know you've gone a little bit too far. So I encourage you to only move in the range that you're not feeling pain. That's super, super important for all of this work. Okay, so moving on. So we're in a good position. We've got the back pretty flat. We're connected through the ribs and pelvis. And then you're going to lift up one leg. Still relaxing through the upper body so that the shoulders are sinking down, the neck is relaxed, and you're just going to start to lift up and down. So you can see that it's just my leg. I'm not lifting my whole pelvis, which this is what that would look like. And this could eventually start to hurt the back. So it's really the bum that's working. So we're strengthening the bum and we're staying relaxed through the upper body here. We'll just do that a couple times so that you can start to feel how the leg bone moves separately from the pelvis, which is our next connection. So we've got the leg bone moves separately from the pelvis. And there's lots of ways we can explore this. So we'll move to the other side, lifting up and down on the other side so that the bum is getting some strength and stability. So a wonderful thing about the pelvic floor is that when our legs and bum are strong and our pelvis is in a good position, our pelvic floor can naturally relax. And our legs can hold us up. Okay, relax that. And we'll come into resting child's pose. So there's a few options here. You want to make sure that your knees are nice and wide, and you can just come down, head resting. If you're feeling like you don't have enough space, you can always use your bolster a couple different ways. So one is just to have it sideways, and one is to have it long ways. So you're just adding a bit more height. Okay, so resting child's pose, just for a few breaths. Sink down. And then find your way back up. So I'm just going to change positions so that you can see me better, but you stay where you are. And I'm going to take my right leg out to the side and just start to rock forward and back. So you might start to feel a little bit of a stretch through the inner thigh, maybe through the inner leg all the way down to the ankle. And again, support your arms if you need. Use your stool if you have lots of tension in neck and shoulders. All right, and then we're going to add in some rotations. So you're just going to lift your heel and start to rotate the leg bone. So this is going to be a really important movement as we move through these classes. So the leg bone rotates without the pelvis moving. So pelvis is nice and stable, and it's just a really small movement of the leg bone. And then we're going to come on up. So you can put your foot back down if that feels better. And here I'm going to have my pelvis and my ribs stacked on top, and I'm going to move into a side bend. So a side bend, I'm stretching through the side of the body. I'm not rotating. So you want to make sure that you're still in this frontal plane and you're reaching to the side. Nice side bend. This frees up the lungs, releases the obliques. And if you feel ever like you have a hard time taking a breath, like your baby's taking up a lot of space, a side bend is really, really lovely to get a better breath in. And then come on up. And we're going to switch sides. So hands back down, slide your foot in, other foot out here. So again, just rocking forward and back. Soften your heart down, soften your jaw, and just feel how your pelvis can move. Feel how that strength can come from the legs and the bum, not from the arms and the neck. And then we're going to turn the toes up and add in that little rotation. So again, it does not have to be a big movement. Sometimes we get stuck in this way of thinking that it has to be a really big movement in order to be useful, but it's not. Sometimes small movements are like vitamins. They're like building blocks. All right, and then place your foot back down. Come on up for the side bend. Side bend. So my ribs are stacked on top of my hips, and I'm just going to reach over without rotating. Okay, so as soon as you start to rotate that rib cage, you're not staying in this frontal plane. You're moving into transverse. Breathe into the rib cage. And then come on up. And we'll come back onto hands and knees and slide the feet back in. So there is a reason that we do that, mindfully coming in and out of poses, is oftentimes that's where we get hurt, is coming out of a pose. So you just want to be really mindful when you're coming out of your poses, going in and coming out, is that you're not just mindlessly moving. Okay. So now we're going to sit back onto, I'm going to turn again, sit back onto your heels or your bolster. So you can always slide your bolster in between your legs here. And we're going to explore another connection. So we're going to go over and over and over these so that you understand and that you can practice them in different positions. All right, so this next one is pelvis, the pelvis moving on the leg bones. So we're just going to start to tip the pelvis back so that we're tipping. If you imagine your leg bones are connected here into these acetabulum, you're going to tilt your pelvis back and then you're going to tilt it forward. Tilt it back and tilt it forward. So it's helpful to feel that. So hands onto the pelvis and just tilt forward and back. Okay, so another thing is if you feel like you don't have a lot of movement there, that's okay. I know how quickly our bodies can change and adapt to new movements. So just take it slow, don't force it, and just move in the range that you can right now. So we've got that down. So we've done 3 connections already. We've done rib cage, pelvis, leg bone, pelvis, and now pelvis on leg bone. That's 3. Okay, awesome. So pelvis on leg bone is perfect. Now we're just going to add a little bit of movement through the spine. So we're going to link it together, sort of like cat-cow. So you're going to tilt your pelvis back and then curl your spine, reach your hands away, and separate your shoulder blades. And then tip the pelvis back so the pubic bone goes towards the ground. Heart lifts, shoulder blades slide together. And then we'll do that a few times. So we're adding in these like undulations of the spine, which can feel really good as we start to, as your body starts to change. So we really want to ensure that you can maintain all of these movements in a way that doesn't hurt. So as always, don't move into pain. All right, so now we just did a little bit of touched on the shoulder blades and the upper back. So another connection we're going to talk about is shoulder blades and how they move on your back. So I'm just going to turn my back to the camera for a minute so that you can see. So you can always change position if you feel like your legs are falling asleep or it's just not comfy for your knees, and just sit, find a comfortable position, and we're going to start to move the shoulder blades. So shoulder blades move up and back and down. And we're going to start to just roll them around on the back. In both directions. Okay. And then we'll try one shoulder blade roll. Both directions. If you're not sure if you're doing it right, you can always place your hand on your blade and just feel that it's moving. Or have someone else place their hand on your blade so that you can feel that it's moving. sometimes it really helps to have some proprioception of your body. So I often encourage people to feel what's happening. So other side, switch so that you're doing the other blade. And if you feel like there's a lot of crunchiness and stickiness in your blade, then move less. Move in the other direction. So make smaller movements until you can move in a range that doesn't crunch or crack or make weird sounds or transfer into your neck. We don't want that. Okay, so we're going to release that. So that's another connection. We've got the shoulder blades on the back rib cage. So that's a really important one to remember as well. And we're going to go over these and over these. So don't feel like you have to remember them all right now. Okay. So we're going to come up to standing and move through sun salutation A. So these are my favorite movements for warming up the body, and it's really, I have practiced sun salutations for so many years, and so just because of Ashtanga, but I've modified them significantly so that they're accessible for pregnant bodies and for anybody. So we're going to just come to stand at near the top of your mat. Make sure you have your blocks handy. So the blocks bring the ground closer to you, and that way you don't have to worry so much if your backs of your legs are really tight, but you can still get lots of space in the front of your body. So just standing in your feet and just feel where you are, just like we started. Sense your body in space. Sense where your pelvis is, your rib cage, the back of your head. And then when you're ready, we're going to inhale and reach the arms up. And then we're going to exhale and sit back. So your bum goes down, you bend into the legs, reach your hands to your knees. Feet are at least hip width apart here, maybe wider, just to accommodate your belly, especially if you're carrying your baby really low. So we're going to inhale and lift the heart and gaze up. And then exhale, curl the spine, separate the shoulder blades. Inhale, lift, shoulder blades slide together. Exhale, curl. And then press it up, arms reach up. Right into the next one. Sit back. Hands to the knees. Moving through those spinal mobilizations. So this is really similar to the one where we're sitting on the heels. And then press it up, arms reach up. Moving into Sun B. Sun Salutation B. Inhale, arms up. Exhale, fold forward. Again, the feet are hip width apart. Bend through the knees, tip the pelvis. So we've got that pelvis on leg bone movement. Hands to the blocks. Big inhale, make some space. Step your foot back. And now we're going to stretch into the feet and legs. So you're just going to allow this movement to be driven by your foot and ankle joint. So you're propelling yourself forward completely through the strength of your foot and ankle, which is so important, especially in pregnancy when you've got more weight on your body. Your feet might be feeling sore, your ankles might be getting stiff. So we want to ensure that we can still move them. It's like a little foot massage here. And then from here, we're going to make our way into a Warrior One. So our Warrior One, our hips and shoulders are looking forward. So we're in the sagittal plane, and we're just going to start to lift the arms up and down a few times. So you may have worked with me before, or you may have learned this already, but there's another connection that we're going to talk about quick, and that's rib cage relative to the arms. Okay? So a lot of the time our arms are not that mobile, so we use our ribs to get our arms a little bit higher. And the problem with that is that we're much more mobile in our spine there. And so we cause ourselves some problems, some pain sometimes. So I just want to ensure that that we're working on the mobility of the arms and the shoulders and not so much this movement of the rib cage. Okay? So we're going to stop if we start to feel the rib cage lifting. And yeah, just have one hand on your ribs, one hand on your, or one arm moving up and down. Okay. Now, lift your back heel, tip your pelvis forward, so we're moving pelvis on leg bones. Lots of strength through that front leg. Hands down, step together. Big breath, make lots of space, and then exhale, fold, relax, soften. We'll move right into the other side. So you're going to step your other foot back, and again, move through the foot and ankle. So you're just kind of rolling over the ball of the foot, lifting the heel as high as you can, and keeping soft through the jaw and the pelvis. So we're just letting that pelvis sink down. Come on up. Warrior one. Again, we're just moving the arms up and down a few times. If you did one arm on the other side, you can try doing one arm on this side. Just that so that you feel that the ribs are pretty relaxed and you're only moving in that range. So if your range right now, if your range is really small before your ribs get involved, like I said before, don't worry. It's easy to change the way that our bodies move. I think often we get stuck in this idea that we'll never change, that our bodies are always going to be stiff or weak, but I don't believe that. All right, lift up your back heel, pelvis on leg bones, tip it forward, and then reach down, step up, big breath, and then come into your forward fold. And then we'll come all the way back up to standing. So that was one sun salutation. I think we'll leave it at that for now. So through the next few classes, we've got flow 1, flow 2, and flow 3. We're going to add in more sun salutations and more modifications for all of these. So if anytime you feel like you just want to do a really basic class, come back to this foundation class. Okay, so I'm standing with the feet at least a leg length apart from each other. And then I'm just going to turn with my left leg out. So my left leg bone is going to rotate, but my pelvis is going to stay pretty neutral. Okay, so we can try that a few times, just rotating the leg bone. Might be hard on your sticky mat. And just trying to keep that pelvis as level or as stable as you can. And then plant your foot down. Okay, next pose is flashlight pose. So flashlight pose is pelvis moving on leg bones. And I want you to imagine that you have a flashlight in your vagina. So this is you'll never forget this cue. And I've taught this many times over the years and people always remember this. So it's a really great way to get your pelvis moving. So we're just gonna think about this flashlight shining towards the back of the mat and then shining up towards the front. So we're just seeing how much movement we have through the pelvis. Okay, so this is the reason I use this cue is because it's really effective. So I've seen people do this, but this is not flashlight. This is moving your rib cage. So we're trying to move the pelvis on the leg bones. Okay, so just notice what you feel here. If you feel pain, go less. Okay, beautiful. Coming into a warrior 2 pose. So front leg is bent, shoulders and hips are looking towards the short edge of your mat, and then you can just start to bring your arms up. And we'll just do a little bit of movement through the arm bones, rotating the arm bones. And then we're going to come into extended side angle. So the elbow comes on top of the knee. Make lots of space in the front of your body. If it feels okay on your neck, you can start to gaze up and then reach your arm up. Nice big stretch through the side. And then we're going to add in a little bit of movement here of the arm bone and the shoulder blade. Not too much. And then we're going to bring it all the way back up and move into, triangle pose. Hands onto the pelvis. So just like flashlight pose, triangle pose the movement originates from the pelvis. So we're going to shine the flashlight back, move from your pelvis, and then reach for wherever is comfortable on your leg, or even for your block. Make lots of space in the front of your body so you don't feel like you're squished. And if you like, you can reach the top arm up. So I always like to remind people that all of these movements should feel good in your body. If it hurts, you've gone a little bit too far. Okay, so bend your leg, come on out of it, and we're going to switch to the other side. So we've got our flashlight on the other side. Just shining it up and down. So we're reminded to move from the pelvis. And then moving into, we forgot to do the leg bone movements. So you can add in those little rotations of the leg bone. Again, just small movements. And then we're going to come into warrior. Just sink in there. Let your legs hold you up and your shoulder blades relax. And then if it feels okay and you don't have tension in your neck and shoulders, lift the arms, move the arm bones a bit, and then find your way to an extended side angle pose. Lots of space, gaze up, reach that arm up and over. Breathe in and out through your nose. And then come on up into triangle pose. Hands onto your pelvis, shine your light back, and reach for wherever is comfortable. So I'm just going to use my block again because I did it on the other side. Land in your legs, relax your upper body, make lots of space in the front, and then reach it up. And you can choose where you like to gaze for this. Does it feel best to gaze at the floor, straight ahead, or up to the ceiling? So I find that if people have a lot of tension in the neck and shoulders, it's really good to start just looking at the ceiling, at the floor, And then bend the leg as you come out, press in through the feet, and come on up. Okay, so we're going to come into some squats. So just heel toe your feet slightly closer together, toes are facing out, and then you're going to sit your bum back. So I just want to change positions so that you can see that I'm not moving into the squat with my knees forward. I'm moving into the squat with my bum back, hands onto the knees. And we're going to add in some movement, so a little bit of a twist here. Just find some free flowing movements. Think about how your rib cage can roll to the side. Think about how your shoulder blades move. You can even add in your head and neck. And then we're going to do some squats. So starting in this position, and we're going to add in, so we're going to use the pelvic floor breath and some movement. So coming to stand. So we're going to inhale, relax, exhale, gather your energy up, inhale, relax, exhale, inhale, exhale, inhale, exhale. heel toe your feet back together. And I just want to mention, if that feels a lot, like if you doing the squats with your legs really wide, if it feels like too much and it feels like too much pressure on your pelvic floor, then you can try with your legs closer, still room for your belly, and just move into the squats that way. Another option is to do it with your blocks stacked up and then just move through the motions there. So you're lifting up and down, you're not putting as much pressure, but you're still getting the benefit of the squat. Okay? All right, so squats are really important for lots of reasons. One is that when you are in a squat position, so actually you're welcome to come into a squat position, use a block and just sit on your block and do it that way, or an active squat so that you're just kind of resting on your feet, knees apart. So the benefits of squat are many. I don't often encourage people to give birth on their back because your sacrum is like a little doorway, okay? And if you're on your back, your sacrum has nowhere to move. If you are in a squat position, your sacrum can lift up and it can act like a little doorway, adding that little more bit of space. Another reason a squat is so important is because it adds about 25% more space into your pelvic outlet. So your pelvic outlet is the space between pubic bone, tailbone, and sitting bones. So that 25% more space is a lot more space. So this is why we want to practice squatting throughout the series so that your body gets used to it. So I recall a friend of mine did not do prenatal yoga, and when she had her babies, she just kind of was thrown into this position where she was like in a really deep squat for a really long time, and she was so sore from that for weeks. And I feel like that could have been mitigated a bit if she had trained for it. So I like to think about prenatal yoga is a training specifically for an event, which is childbirth, labor, childbirth, and recovery. That's a really important piece. We're not just training to give birth to a baby. We're training to have a better recovery after, so that we're set up to just be better off after we give birth. So our bodies are in better shape, our minds are in better shape, our soul is taken care of. There's just so many facets to that. So we're training specifically for labor, birth, recovery. Okay. So the last thing we're going to do is a side lying release. So this is a really lovely pose. There's a couple of ways you can do it. So you can, if you have either, you probably don't have a felt pad, but I'll give you some options here. So you've got either one of these Coregeous balls, which are amazing, well worth the $20 that they sell them for, because there's a ton of things that I use them for in prenatal yoga. Another thing is a blanket. So a firm blanket, like a Mexican blanket, will work really great here, or a thick towel. So not a really squishy, soft blanket. So if I had my Mexican blanket or my towel, I would just roll it up so it's in like a little burrito shape. Okay, so you've got your rolled up towel or your ball, your choice. And we're going to move into a side lying release. So knees are bent, towel or blanket underneath the rib cage. So this is important. You want to make sure that you have it in the correct position, not down here, like beside your belly, on your waist, but right beside, like on your rib cage, sort of beside your boob. So I'll talk about that in a second. So you're gonna lay yourself over the roll, so your shoulders on the ground and your head is supported by your pillow. Okay, and just check in so your hips and your shoulders and your head are all lined up, knees are bent to support you, and you've got your roll underneath. Now, this is going to help with being able to take a big breath with that frontal plane movement to support our bodies, and relaxing and releasing through the neck and the shoulder blades. So from this position, you can just start to roll that top shoulder blade around. Okay, just do it a few times and then relax and breathe. So at any time if this feels like too much, and if your rib cage is stiff, it will feel like a lot. So you can always come up, re-roll so that your roll is about half the size, and try again. And you'll notice as you do it more, it becomes easier. So as you lay here, just make sure that your neck and your jaw are relaxed. Your inner thighs are relaxed. Oftentimes our inner thighs want to clench and hold us, but see if you can relax that. Another good option, if your inner thighs are really tight, is to just place a bolster or blanket in between your knees. And that gives you a bit more support and you can soften into the pose a bit better. So I would stay here from anywhere for like 2 to 10 minutes on each side. So that's quite a chunk of time. But if you have only 5 minutes, just do 2 minutes each side. And then to come out of it, you just want to press yourself up using your arms. So you're not going to use your abdominal muscles to press yourself up. You're going to use your arms. And then switch on to the other side. I'm going to zip through this because you can always stop the camera and just take as much time in the side lying release as you like. So setting yourself up on the other side, ensure that you've got the roll in the right spot, right underneath your armpit, shoulders on the ground, head on the pillow. Now, if you feel like if your boobs are quite sore, and this is squishing them, then you're probably too far forward. So you can just rotate a little bit and sort of get right on the rib cage. And then just, again, move the shoulder blade a few times. So as you're moving, you're not increasing tension in the neck. You're just letting the shoulder blade move on its own on the rib cage. Relax it and just breathe. So I encourage you to breathe into the rib cage, not into the belly here. And the reason is that we want to encourage some mobility of the rib cage and some softness through the muscles that are in between the ribs. So those muscles can get really, really tight and they can impede your breath. And then you totally bypass that breathing in the rib cage. And there's lots of reasons why breathing in the rib cage is important. Keeps your heart and lungs really healthy. It keeps your upper spine more mobilized so that you can move better and have less tension in the shoulders, in the neck. Sometimes headaches or tension headaches wrap around from the back of the body all the way up to the forehead, and that can be caused by a really tight rib cage. So there's lots of reasons that we want to hang out in this side bend. But make sure when you do it that you can breathe fully, that you're not sitting there just gritting your teeth and getting through it. You want to make sure that you're comfortable, that you're supported, and that you can relax. Otherwise, it's kind of pointless. Okay, so that is most of the foundations class. I do want to introduce to you the Shavasana. So Shavasana is, you will need your bolster and your blocks, and you're just going to stack your blocks up, rest your bolster on top. These are not ideal because they're slippery. They're wood. And then you lay yourself down. So bum, tailbone right against the bolster, and then lean back. Yeah, these are going to go. Okay, hold on. So blocks that are not wooden and really slippery are probably a better bet for Shavasana, because I wouldn't want anyone to get into a position and then have your blocks slide out, because that wouldn't be fun. tailbone right against the bolster, lean back, and then just kind of adjust yourself. So you can have your knees bent or straight. And if you feel like you need more support, you can always add a blanket or a block underneath your bum if you've got a lot of curve in your back and it hurts. If you're really long in the torso, you can add a block underneath your head or a pillow for a bit extra support. And if your arms are quite short and they're uncomfortable and you've got some tension through the neck, collar blades, or the chest, you can always put something underneath your arms. So a rolled up blanket or bolsters can be really helpful. And another thing is to have a bolster underneath the knees so that you can rest your legs on your bolster to relax. So I encourage you to get yourself set up for Shavasana so that you're completely supported and relaxed. Every part of you can soften into this pose. And then I encourage you to cue up the guided relaxation. There will be 3 guided relaxation in your course, and you can use any one of those and spend at least 10 minutes in Shavasana. So that Shavasana starts to build our capability to visualize, build trust within our bodies, and build resilience. And also the ability to relax is so important as we move forward on this journey. So I really encourage you to take advantage of the relaxation tracks and to use them as much as you can. All right, so that is our foundations class. And there's lots more to come. So remember those few keys that we talked about, and namaste. See you next time.